My name is Sergio Jaime. I'm from the Argentina Patagonia. I represent the Asociación Civil Horizonte Sur, who we usually are involved in community intervention and investigation in the field of community health. So let's see some information, some data from Latin America. Latin America is a region with a huge socioeconomic gap, and the environment-related health problems are a major issue. These problems obviously are deeper, serious, and with greater consequence in vulnerable communities that in our continent, in our subcontinent, is a major topic too. The question is, if that is the situation, why there are not so many studies or intervention published in community environmental health? That is the big question. We believe that this is because three situations, and this situation reflects how these problems are driven here in our subcontinent. We believe that there are some policies that limit or hinder this kind of initiative to intervention, comprehensive intervention that involves the environment. Also, we believe that there are promising actions, but with several limitations to expand their potential. And we believe also that there is, in fact, action that achieved a demonstrable impact, but they are hidden for the public, so most people can use this experience to make their own program, their own initiatives. So let's see the first situation. In this presentation, we try to give some examples about this situation in Latin America, in the Patagonia Argentina, probably in Latin America. Sometimes will be some people will feel identified with this situation. Let's talk about health campaign. We call health campaign to powerful field activities in a short space of time. Mainly, this campaign are oriented to anthropometry, immunization, and a fast physical examination. This activity in the last years are a condition to the payment of the universal assistance system, that is a system of pay for each vulnerable family receives an economic transfer each month, but they receive this transfer if they fulfill some condition. One of the conditions is to have this fast physical examination, their immunization in time. And why we say that these kind of activities limit or hinder comprehensive intervention? Well, in the first level of care, these kind of activities occupy a disproportionate fraction of the care efforts. In our series, in sometimes 40% of all the activities are oriented to these kind of activities. And the other problem is the culture of these activities. It's a gobi culture. A gobi culture where it's a restrictive service provision, and we believe that this culture limit or the possibilities of a comprehensive intervention that includes the environment. And by other side, where because there is money in the middle, obviously the users and the manager of health policies are always making pressure to privilege this kind of activities. We are not saying that the effort of the healthcare teams doesn't work. We are saying that this kind of activity doesn't add value, doesn't improve the autonomy of the people, and there are some evidence that say that there are low efficiency activities. Other example of activities that limit comprehensive intervention is this program. This program, the warning program carried out in Argentina between 2004 and 2007, that has very funny names. The people who know Spanish will will be probably low because they probably was commonly named Shaolombriz. This program tried to reduce the impact of helminths in children, assuming that this kind of disease are very linked to the malnutrition problems. This program was carried out in the old territory of Argentina, and it was very popular in those years. You see in the photographs some, including some merchandising of the program provided by the federal authorities to all the territory. And why we say that this kind of activities, the logic of this kind of activities limits a comprehensive intervention that includes environment. In first place, because are massive and mechanical. So much mechanical that they don't see some cultural and geographic characteristics that must be included in this program. For example, in my province, Chubut, you see it noted in red in the table in the left of the screen, the prevalence of helminth is zero, null. There are no, because the climate, the environment doesn't allow this kind of helminth in our territory. But even noting that, the program was carried out. And that's not other problem of this kind of program. That is the pseudo-institutionalization. We call this that the program is more important than the needs that gives the reason of those programs. And when you see worms, you see a biomedic interpretation of the diseases. And when you see worms, you don't see environment. That is what you have to see in the first place. And when you do this massive initiative, you give a little space from effective community participation, and with that, you ignore social constraints that are a very important issue in this kind of situations. Well, so let's go further. Second situation, more elaborated situations that are usual in our context. Let me show you this example. This is an outbreak of shigellosis in Barrio Moreira in 2021. It happened an outbreak of Shigella flegneri with dysenteric syndrome in 22 children in a very short area with very vulnerable population. And we go to the field and we found what the people believes that are water in the street. In fact, it was that the paper white, the provision of water, it was affluent and contaminated, and this was the source of the outbreak. We make a fast intervention to the people. We explain. They were concerned, as we are, about these diseases because it was a very high impact in the community. And we make some agreement. We make with the local health team a rapid response to all the people who consult for this situation. And we make some pressure to the local authorities to say, because the kind of infrastructure that these people need, they can afford them. So we ask to the local authority to help them to make more a safer water supply. Obviously, we understand that this changed the environment, but we can learn from this. What can we learn? That generates a positive association when we have similar needs with the community. That a rapid response, in this case, an outbreak in the community, gives a very, very good impression with the people. They respond also helping us to consecute the same objectives. In this situation, the elements of the environment were properly analyzed, and we generate some community mobilization. And obviously, that generates a response from the government to give some answer to this problem. That it was a very big problem in that moment. And we wonder, what if this common experience could be systematized? What if we give some skills to the community health workers or the local health team, some skill to comprehensive intervention, for example, to understand how to do a quick and dirty approach of environmental problems or health-related environment health-related problems. And we believe that this kind of problem could serve as a platform to a more elaborated and more broader aspect of those communities that has several needs. Not only their lives are very hard, they have to work a lot, they have a lot of needs, and obviously you can say one problem. There are several problems that must be resolved. We say that systematized solution is an issue when we talk with community, with unique community, with the singular context. And this is an example of, I love these experiences, social cartography for adaptation of public policies. In Argentina, so that is like the Ogisto presentation, there is a policy that carried out in the last year where no childbirth care can be done in the rural setting. So all the childbirth must be done in the urban setting where are maternities, where they have the infrastructure that the government said is mandatory for this kind of situation. So we make this, through this methodology, we make an approach, participatory approach, and we have very good results. For example, give us a solid experience about how to do a formative research, providing a systematization about how to adaptate public health policies and create a space of harmonization between the public agenda, the top-down agenda, and the bottom-up agenda, and in a ludic space, very mobilizing for the community. Those photographies, both the previously and this one, are made in a very remote areas, 400 kilometers from the nearest city, and very small, 2,000, 1,000 population each one. And we wonder, what if we can recommend to the politician, to the health policy manager, to do in transcendent issues, for example, childbirth, to be sensitive to local expectation. That is not impossible. And we believe that this is the way for carry out some environment problem, some unique context, some geographical context, cultural context that must be taken in account when you design a policy. So we are going further, one step more. We say that there are activities that probably must be changed to do some positive impact in the communities and the society. We say that there are some ones, but they are limited, their impact, they must go further to find better results. And we're trying to find an example of an activity that make a change and related with environment and environment health-related problems. So we found this. Well, let me talk about the context. Heating in the Patagonian Plateau. The Chubut Plateau, the province where I live in the center of the Argentinian Patagonia, is a semi-desert area with great climatic adversity. The intra-domiciliary habitat is the dominant one. The usual way of eating and cooking is with firewood. And the firewood is a scarce resource because it's a semi-desertic area. And obviously, all people know that there is evidence that indoor pollution is a transcendent phenomenon in Latin America and all the people, mostly vulnerable people. So I get with this experience. Pablo Batro in 1994 designed this manual, Estufas a leña de alto rendimiento, high performance wood stove. And we believe that this is an example of a high impact cross-sectoral experience. And let me tell you why we believe this. As every successful experience has a very nice story. Pablo Batro was an industrial engineer who worked in the National Institute of Agricultural Technology, and he was very sensitive about the process of desertification of the Chubut Plateau. He visited the northern of Europe. He began to think, because he was in industrial engineering, how to develop a model of a stove that was efficient and adapted to the context of the Chubutense plateau, the plateau of Chubut. So he make this model. He get the support of this institution that is not a health institution, it's an institution who try to develop agriculture and agriculture technology in that region, in Trelew and the zone of influence. Let me show you what happens later. He created a manual. His manual becomes very popular. Many people around Trelew in the rural setting began to build these kind of stoves. A few years later, a group of investigators that are very sensitive about indoor pollution asked in a very remote area, they make a pilot study about if these high efficiency stoves improves indoor pollution. And in fact, they found that it does. And the indoor pollution reduction, it was very, very relevant, very transcendent. So they make a second study in 2004, where make stoves and and kitchens all with the same system, and they found very significant results. After that, in 2010, a social housing program includes this social stove in the construction of houses. And in 2015, the federal government make a massive program to provide this technology to all the territory of Argentina. Argentina is a very large country, so it was a big challenge to do it. And let me show you why I say that this is intervention with a very high impact. The territorial dispersion of this intervention, it was enormous. Argentina is a very big country. And you see that we found this program in places so far away as 2,000 kilometers away from it was originated. And we found that in 7 regions, they have a former program to provide this kind of stove. There is solid evidence that they are very efficient, very efficient. It's like when you have a regular stove, you have something like 30% of efficiency. These have 80% of efficiency, and this means not only that there is efficient, that you need less fuel to be warm and to cook. And there are many studies that proves the reduction of intradomiciliary particles and indoor pollution with biologic evidence. Some studies were made with carbon monoxide aspirated, and the results were very, very, very positive. By the other side, politicians love this initiative. They really love. We found articles in all the country, all around the country, with politicians that are very sensitive to this initiative, and they support when they know about this initiative to do it in their territory. I believe that this is a main factor, because when you design it and the design of the project is very is properly, you obtain also politic supports when the politicians are obviously reasonable. And by the other side, this initiative has the sum of value. For example, they are called solidarity stoves. There are a lot of social enterprises who are around this initiative, enterprises that provide materials, resources, fuel to do these stoves in all around the country. Obviously, decrease the use of biomass fuel, and that is very good news, mostly knowing that in the Patagonian plateau, the firewood is a scarce resource, and there is a low cost and feasibly with local input, something that Pablo Patro in 1994 was very worried about, that this stove can be made with the local input. So this experience has a sort. There are no publication about all these are hidden, but I believe that this is the way to do a high impact strategy intervention in environment. And let me tell you what can we learn from all this. Outstanding person, health champions make a difference. I wonder, what if were no Pablo Patro, were no Marcela Reñando and Coles investigating about air pollution? What will happen? Well, obviously, this intervention will emerge in the way that it emerged. Understanding the context is critical to achieve a good solution. A deep understanding of a need and a careful design are a powerful combination. And when this combination works, they extend their benefit. They are not the benefit only for the situation that the initial expectations are broader, much more, and that could serve as platform for another initiative. Because, as I say, when you talk with vulnerable situation, there are not only one situation, there are several situations, and you need this kind of intervention to serve as platform for further intervention, and more comprehensive and including environment that is a major issue in our region. So that is all. Thank you. I hope you understand my English, and and with that I finish my presentation.